Deep gum pockets can collect bacterial biofilm and harden deposits below the visible gum line. A dental professional carefully evaluates the gum pocket before deciding on the most appropriate treatment. Plaque bacteria and hardened calculus can collect on root surfaces inside deeper gum pockets. Professional instruments are carefully guided beneath the gum line to reach affected root surfaces. Accessible hardened calculus is carefully removed from the root surface using professional techniques. Cleaning the root surface helps reduce bacterial biofilm in the treated area, supporting ongoing periodontal care. The treated area may be gently rinsed to help clear loosened debris after professional cleaning. After cleaning, the treated area is evaluated to determine whether additional periodontal care may be needed. Professional deep cleaning may improve root surface cleanliness, but long-term gum health depends on ongoing professional care and daily oral hygiene. This video is for general education only. Gum pockets must be professionally treated by a qualified dental professional